Thank you so much, Tim. I appreciate it. And thank you, everybody, for joining today. My name is Caitlin. I'm with CoverMyMeds, and I work mainly with our physician offices. I'm going to click here. A little bit of background. CoverMyMeds is a website for prior authorizations. We have forms for all medications and all health plans. This is including all Medicare Part D, Medicaid, and commercial plans. It's one place where offices can find the form they need, fill it out quickly, and get it sent over to the insurance plan. And best of all, it is completely free. So currently, what offices are doing with prior authorizations, they are having trouble finding current prior auth forms. Some offices will keep almost like a prior auth binder with forms that they use regularly. Well, plans are constantly updating their forms, and a lot of times those will soon be outdated. One place to organize and store completed and blank forms, creating a handwritten form each time one is needed, and then there's downtime waiting for a physician signature prior to submitting it over to the plan. Most importantly, prior authorization, they take a lot of time away from the patient. Typically, prior auths take about 20 minutes to complete. Calling the health plan, waiting on hold, getting transferred back and forth to the right department, and then getting that form faxed over to their office. Like I said, sometimes that can take about 20 minutes, and some plans even have a whole day to get that form faxed over to the physician's office. So CoverMyMeds provides a solution. We have forms for we have more than 9,000 prior auth forms. This is including step, edit, and quantity limit forms. So we use the word prior auth pretty loosely. Like I said, we've got all plans. We've got a growing network of pharmacies that are using CoverMyMeds, and they're willing to start the prior auth for the office. This is helpful because physician offices don't always know the drug coverage information. Pharmacies always have that information, though. Physicians sometimes get the medical coverage. So it's really helpful for the physician's office when the pharmacy will start the prior auth, and they can even fill in a lot of the information. CoverMyMeds is web-based, which means it's available 24/7, but we have live customer support available Monday through Friday, Eastern Time, 8 a.m. to 11 p.m., and on Saturdays from 8 to 3. We've got support via phone, email, and chat. This is something we're very proud of. We've got our phone number. If you give that a call during our support hours, you're always going to get a person, never a prompt, and it's going to be somebody who can help right away because we know how frustrating it is to be put on hold. We've also got a live chat. At the bottom right-hand corner of every single page in CoverMyMeds, there's a live chat box, and that is, again, somebody who's going to help right away. Offices can chat with us. They'll get a response within a couple of seconds from a live person. It is fully HIPAA compliant, and then, of course, it is free to prescribers' offices and pharmacies. So some key things that we can bring to offices. We have, again, all drugs, all health plans, and it's all in one spot. So CoverMyMeds, it's a provider-centered workflow rather than a plan-centered workflow. So the problem isn't always that the plan's process is hard. It's that there are so many different processes. So we adapt to each plan and make it one central process. You can quickly find forms, fill them out, and send them over to the plan within about 5 minutes. And then, of course, it's free because we are paid by pharmaceutical manufacturers on a brand-by-brand basis, but we do have all drugs available. And then we've built this from the ground up with integrated security and compliance, so it's completely safe, and again, it's HIPAA compliant. I have included some benefits of CoverMyMeds. These are quotes that we've heard from some of our users. One of them, I used to beg the doctor to switch the medication so I didn't have to do a prior auth. Now I do the PA right away. I don't even file it in the to-do pile. So this is going to help keep your patients on their preferred medications rather than having to switch them to avoid a prior authorization. It's not such a hassle anymore. Another one, this is the best product I have used, not just in healthcare, ever. That was from one of our nurses who uses it in Florida, and he actually chatted with us the other day, told us that he has reached his 1,000th PA on CoverMyMeds, so he was pretty excited. We sent him some cookies. All right, I'll go to the next one here. What I'm going to do now is I'm going to walk through the process. This is a high-level overview of how it works. I do want to invite everybody to create a CoverMyMeds account and look around as well. Excuse me. So first step, logging into CoverMyMeds. Go to CoverMyMeds.com. This is where it will take you, and our users can click to log in. Then they're going to be taken to the page where they can actually pull up the form. All we need to find the form is 3 key pieces of information: the patient's state, the medication, and the plan information. Usually what's easiest is the name of the plan, and then the system's going to present you with the best form options. We have them rated so that the best forms will pop up first. That's the one that the office can pick, and then they can click to start their request. So this will take them to a page where they can complete the form. We'll include the image of the form, the plan's actual prior auth form, but we've laid it out in fields that'll be easier for the offices to fill in. We've broken it up in a few sections. We've got patient details, provider details, and medical details. Some cool things along the way that CoverMyMeds really helps with, especially to save time. We actually have address books that can be utilized. We've got a patient address book and a prescriber address book. What this means is as soon as the office uses a patient or a prescriber for the very first time, any information that's going to be entered in about them will be saved to their account. So then the next time they go to do a prior auth for the same patient, let's say they need a prior auth for a different medication, they're going to be able to autofill all of those details rather than having to handwrite all that demographic information for each form. Same thing with the provider. A lot of forms are going to ask for NPI numbers, again, the phone, fax, address, things like that for the prescriber, and that's information that can be saved, and it's especially helpful to offices who have more than one prescriber, as they can save multiple prescribers in that address book and autofill those details. With a lot of forms, that's almost half the form right there, and then they can fill out the medical details based on the patient's chart. Once they've got that form filled out, again, it takes just a couple of minutes to fill it out here, they can actually fax it right from the website. So on the left side of the screen, there's a list of blue buttons. There's fax request. Clicking on fax request will ask you to choose a destination. The physician's offices can choose to plan. And then that's going to take them to one final page. So here, the form is shown. The plan's fax number is going to be autofilled. And the prescriber can even sign digitally with the mouse to form a signature. The cool thing is, just like our address book, as soon as the signature is used here one time, and this is faxed, it's going to send it directly over to the plan, and that's also going to save the signature in the account. So it's one and done. It's added in there one time, and then it's going to be saved in the account. We know a lot of holdup in getting these prior auths sent over to the plan is waiting for a free moment when that prescriber is available to sign. Now, the office staff is going to be able to start the form, fill it out, and send it over to the plan very quickly.
We have about 2 minutes.
Okay, thank you. So once this is sent over to the plan receives it like they normally receive their prior auths, and they're going to respond directly to you with a determination via fax. And then once that determination is received, the office can archive the form, and basically that's clicking on a link that says archive, it's marking what the determination was, and that moves it off of the dashboard. And the dashboard's a great way to manage follow-up, and you can use it kind of like a prior auth filing cabinet. We provide some great help tools on CoverMyMeds as well. We've got some videos and FAQs. We've got a user's guide, which basically walks through step-by-step of the process. We've got all of our contact information there, and then, of course, we highlight our live chat because that's the most popular way to get a hold of us.